Good morning, Supervisors. Good morning, community. Thank you for this opportunity to provide an update on our response to COVID-19, the coronavirus, in Marin County. I'm going to take this opportunity also to not only discuss the declaration of a state of public health emergency, but also just to have a chance to step back and orient ourselves to COVID-19 as a community, and make sure that as we enter into what will be likely months of response, that we have clear channels of communication and have a common understanding of the nature of this virus and what our strategies are. There's been a lot of information about this. There's been an epidemic of misinformation as well, and I want to make sure that we are established as a credible source of reliable and locally relevant information ongoing. So this is an image of the coronavirus itself. The knobs on the virus here represent the receptors that allow it to attach to lung cells and other cells in the body, which is what causes the disease. Coronaviruses are a family of viruses that actually are well known to us and more commonly cause common colds. It's a virus that is exchanged mostly in animal populations, but it does sometimes spread into humans, and there are seven different types of coronaviruses that infect humans. 4 of them cause common colds, and it's one of the most common cause of the cold. There are 3 others that are more virulent and cause more serious disease. You may remember MERS, the Middle Eastern Respiratory Syndrome, SARS, both of which were serious outbreaks in the last 10 years that have resolved and caused more serious illness. And now COVID-19 is the 3rd form of coronavirus that now causes disease in human populations. This is the current epidemic as it's spreading across the globe. It is now, we can refer to this as a pandemic. Pandemic really means that it just refers to the number of nations across the country that have been experiencing cases. More than 50 nations across the country, across the world, are seeing local transmission of coronavirus, which is established as in all intents and purposes as a pandemic, although the World Health Organization has still not made that declaration formally. It's important to remember that pandemic doesn't necessarily refer to the severity of the disease, but rather the scope of the disease in terms of global penetration. Every continent for Antarctica is experiencing some form of coronavirus spread. This is the local picture in Marin County. We have 1 confirmed case in Marin. That was confirmed over the weekend, and there was a press release yesterday informing our community that one of our community members, our first, had been diagnosed with coronavirus. This was a gentleman who had been on the cruise ship that traveled from San Francisco to Mexico and back, returning to San Francisco on the 21st of February. The Grand Princess cruise ship. We knew where the source of that infection occurred because the CDC had notified us that there was transmission of coronavirus on that cruise ship. That person's family members have been isolated from the community as soon as he developed symptoms, and they have been tested, and the testing is pending. The results of those tests are pending. We've done 15 tests so far as of this is yesterday. 4 of them have returned negative. We have 11 persons who are under investigation, and that's a formal designation by the CDC for people who have sufficient risk for disease that we are allowed to test them in public health laboratories. 3 patients who are under investigation for coronavirus have been hospitalized, including our confirmed case, and we have 10 lab results waiting. So you can see that Marin County is a relatively low-burden county relative to other counties in the region with regards to coronavirus. Santa Clara County has more than 40 cases, and other counties are seeing much more rapid evidence of community transmission. We see ourselves as being part of a regional ecosystem with regards to our people. We have a lot of people who live in Marin County but work in the city. And so much of our response, including the declaration of a state of local public health emergency and the recommendation to cancel certain kinds of events, arises out of the recognition that Marin County is not an island, and that we are tied to communities that have much more evidence of local spread, and our goal is to prevent that from occurring here. On March 3rd, we declared the local health emergency, and the county also proclaimed two different emergency declaration. One was the local public health emergency, and the other is a local state of emergency for the county. On March 4th, we activated the Emergency Operations Center to coordinate a response among agencies and healthcare partners, and that's been an incredibly helpful source of bringing all the agencies together that need to be coordinated in the response from healthcare to our first responders and other agencies. What we know about COVID-19, a lot of our response is obviously based on the nature of the virus itself, and we are learning a lot every day about the infectiousness and the virulence of this disease. It is believed to be slightly more infectious than influenza, and I think these comparisons with influenza are important. The severity is about 16% of people who are infected show more severe symptoms, so the majority of people who are infected are having mild or no symptoms. At-risk groups, we're really most concerned about those who are our elders and people who have weakened immune systems. Like influenza, when we look at mortality for COVID-19, the vast majority of people in other parts of the world where they have higher burden who have passed from this are people with known risk factors, especially older age. Children, importantly, are actually relatively spared. The diseases, when it occurs in children, are very mild, and we're not seeing over 5,000 deaths that have occurred, very few, if any, in children under 9 years of age. Incubation period is 2 to 4 days, and that's basically the period between when someone may have been exposed and infected and when they would develop symptoms. Another important comparison to influenza, every year come August, September, we're promoting the influenza vaccine and talking about the seriousness of influenza and the fact that it is the leading cause of infectious disease death in the United States and in Marin County. It's ironic, often that the response is sort of viewed as a public service announcement, and about half of people don't actually choose to get vaccinated against influenza. And yet, if we look at the numbers, this is a slide that reflects mortality rates for influenza every year since 2010 for the flu season that goes from October through March. And what we see is there's several, 30,000 to 60,000 deaths most years from influenza in the United States, and we have clear ways to prevent that from occurring. So we do want to remind everyone that one of the most effective ways to keep healthy is to practice the same practices that we've been recommending to protect us against influenza, especially the respiratory etiquette. COVID-19 is spread the same way that influenza is spread, through droplets. So when someone sneezes or coughs into the air, the droplets will settle on a surface. Someone might touch that surface and then touch their face and become infected that way. So all of the message you're hearing about hand washing and respiratory etiquette in terms of coughing or sneezing into your sleeve, staying home from work or school if you're feeling sick. One of the silver linings around this is that I think if we really double down on those messages, in general, based on fear for COVID-19, we'll see much less transmission of influenza as well, especially if it's combined with people actually choosing to get that influenza vaccine. This is just a news report here in Marin. We do what we can to try and make sure that our community is aware of the risk of influenza. And there was two deaths from influenza in our county earlier this year, which was headlined in the Independent Journal. Emerging evidence of the virulence of COVID-19, I think this is also just important for context. In countries that are more like our community, we're seeing much lower death rates than were experienced in the early days of this outbreak in China. In South Korea, for example, over 7,000 cases, 53 total deaths, which is a death rate of less than 1%. In Germany, over 1,000 cases with 2 deaths, which is a mortality rate of about 0.16%. These are very similar to death rates from influenza itself, and is reassuring that if we implement procedures similar to those being implemented in those countries, that we might expect a virulence or a mortality that way. I'm not sharing this to diminish our concerns around COVID-19. We are obviously very interested and focusing and prioritizing a robust community response to prevent the spread of COVID-19, but I think some of the collective fear and anxiety and even panic around this needs to be modulated based on what we know about the emerging evidence of its true mortality risk. Some of the things we're doing, and I'll just get into some of the strategies we're employing here in Marin for our response. One is we need to know what our burden is in our own community in order to inform our response. So we're putting into place surveillance systems for COVID-19. We are working with all of our hospitals, emergency departments, and urgent care centers, as well as our emergency medical services 911 system, to do daily queries of influenza-like illness. The symptoms of COVID-19 are very similar to a cold and a flu. It tends to be respiratory illness. Fever, cough, a runny nose, sneeze, sore throat. Obviously very common. So we are tracking on a daily basis the incidence of those things as they appear in our clinics and across the county to see if there's a spike in the proportion of cases who come in with those symptoms. We're also looking at, obviously, the incidence and the cases of COVID-19 that have been diagnosed also as a marker of potential community transmission. Testing has been one of the main challenges in our national response to COVID-19. Everyone is aware that there has been a scarcity of test kits available. Fortunately, that has changed yesterday. Starting yesterday, some of our private laboratories, including LabCorp and Quest, acquired the ability to do testing, and some of our clinicians are already starting to use those laboratories for testing. We are working to make sure that our clinicians understand the implications of testing before they recommend testing for all of their patients that may be having respiratory symptoms. We're also increasing capacity for testing in our public health labs. The Napa, Solano, Yolo, Marin laboratory that we use has received 90 test kits, and we are now able to offer that laboratory for our patients. We also have been using the laboratory, the California Department of Public Health laboratory across the bridge in Richmond. So testing capacity in terms of the number of tests available to us is no longer a limitation. It does require special equipment to test because anyone who may have COVID-19 should be approached with the proper protective equipment by any healthcare worker. It is not all clinics have the ability to implement those infection control practices because it requires a gown, a face mask, an N95 mask, gloves, etc. So we are working with clinicians who may be concerned about patients who may have COVID-19 to obtain testing for them on their behalf at testing centers we are establishing in the county. We will be implementing later today. It was piloted last week successfully with 5 patients, a drive-through testing option where people can drive up once it's been determined that through their clinician that they need testing, and we can obtain that testing for them in an environment that is outside of the clinical setting and more convenient for the patients and safer for the community. This is importantly on a referral basis from clinicians. This is not something that is being publicly offered. Any person who comes for that kind of testing would have had a conversation with public health to determine the appropriateness of testing and to ensure that clinicians are equipped to respond to the positive results that might occur. Other aspects of the healthcare system response, we're working with hospitals, clinics, and first responders to make sure that they're well equipped to control the spread. That involves, of course, for their own protection, making sure that they have all the the personal protective equipment, the PPE that they need. And we are responding to resource requests to make sure that they are well supplied. We currently have adequate supply county-wide. We're working with them to make sure that they're rationing those most precious of those resources, including the N95 or the P100 masks, so that they're really only using them when in patients where they might have reasonable suspicion that there's a risk. And then we've worked with them to drill and implement those infection control practices. This is what hospitals and clinics do well every day, and we're just making sure that they're on their A game when they're responding. We're also working to increase capacity for remote visits. This is something that Kaiser, Marin Community Clinics, Marin Health, all working with their patient population to encourage telephonic visits and video visits rather than coming into the hospital or the clinic or the emergency room for care if they're having respiratory symptoms. And most people essentially need reassurance and maybe a decision of whether or not testing might need to occur. And if there's a decision that testing occurs, we've made ourselves available, as I said, for testing. Some of the community interventions, and this gets to the resolution that was just heard. We are, with regards to schools, obviously schools are one of our most sensitive environments in terms of these decisions. We've been working closely with the Marin County Office of Education and having regular calls with school superintendents and principals. We are not recommending preemptive school closures, and that is not being recommended anywhere in the state of California. I'm on regular calls with the other health officers around the region. And there is really, and we are secure that there is no evidence for the effectiveness at this point of any preemptive school closures, especially in the absence of any clear criteria for when those schools may reopen. If they were closed preemptively at this point in the epidemic, there's no clear trigger for when they may reopen because we're not seeing active community transmission here in Marin County at this point. And would effectively be a decision to close schools for the rest of the year if they were closing based on the current situation. So the closure policy now for schools is one case, one school. So if we do have a case of COVID-19 in a school community, we will close that school for a 14-day period, which represents the incubation period. Any child who remains asymptomatic during that 14 days is presumed free of infection because they haven't had symptoms. They will return to school. Those that may have developed symptoms based on an exposure in the school will be known and will have been isolated and have been at home, and we can then treat them and test others in that environment. That is one of the ways that we prevent more widespread community spread. Enhanced school-based precautions. Obviously, we're working with the schools to make sure they're using rigorous hand hygiene and making sure that, as I said, in terms of the things we do to prevent influenza, we want to really make sure that we're also using those strategies to prevent COVID-19, especially when children may be sick, to stay home. And if they become sick during the course of the school day or a teacher recognizes that a child might be ill, febrile, coughing, that child actually be isolated and call the parents and have that kid go home during the course of the day. Large gatherings, where we have recommended, again, following the epidemiology regionally and seeing more evidence of community spread throughout the Bay Area, and consistent with recommendations being offered regionally. We are recommending canceling or postponing non-essential indoor gatherings of 100 or more people starting now. And that is a sequential approach. It's, the cancellations is not an on-off switch. We are going to be recommending canceling gatherings based on the emerging epidemic, what we're seeing about our own community spread, and the community, the population that we're most concerned about. So, for example, we are not currently recommending outdoor gatherings be canceled because the risk of transmission in the outdoors, where there's plenty of ventilation of transmission, is much lower than it is indoors. These recommendations to cancel or postpone large gatherings are partly driven by what we're recognizing about the risk for older people and vulnerable people. Almost all of the deaths, as I said, are in people above age 65 or people with weakened immune systems. We can expect to see more COVID-19 spread in our community, and I want to be clear on that point. We are not surprised to find our first case, and we will not be surprised to find our second, third, fourth, et cetera. That is a regional experience, and that is the nature of this epidemic. And our goal is to limit the impact and to limit the social disruption of that increase in incidence that we expect to find. Limiting those occasions in which transmission may occur by limiting gatherings is one step. And the goal is obviously to limit opportunities for person-to-person spread that might occur when people are gathered close together. a 6 feet distance with those droplet precautions. It's about a 6 feet radius where the droplets don't spread far. And so that's one of the reasons why close gatherings of many people increase risk. We're also, as a community intervention, just working on offering clear and consistent public messaging to all of our sectors. This finally is the most important point, I think. This is a graphic that just shows kind of the 6 most important things everyone in the community can do to limit our experience and the burden to limit the burden of COVID-19 as we experience it in Marin. First is, and I know this is a message that people are maybe getting tired of hearing, but it is so important and so basic, which is wash your hands often with soap and water for at least 20 seconds. That's happy birthday to you twice. Which 20 seconds is longer than it seems when you're washing your hands. It's about 4 times longer than I think most people wash their hands for. Avoid touching your eyes, nose, and mouth. Again, that's because the droplets can settle on surfaces. If you touch surfaces, you can touch your eyes, nose, or your mouth. It's amazing to see how frequently people actually do touch their faces unconsciously. And I've been conscious to not do too much of that here as I'm speaking to you because it's... There's some viral, videos of people who are talking about not touching their hands and eyes and then doing it while they're actually offering that message. Cover your cough or sneeze with a tissue and throw it away. If you don't have a tissue on hand, make sure that you're coughing into your sleeve or sneezing into your sleeve. Using a disinfectant frequently on frequently touched surfaces, and we're working, again with the schools and other partners to make sure that that's a practice that, while it's always been in place, that they're really making sure they're being they're following those procedures every day. And then staying home when you're sick, except to get medical care. And even now, when people need medical care, the message is to actually reach out, by phone to your doctor first, and then avoid close contact with people who are sick. And that last recommendation is we're facilitating that by offering the closures. Finally, these are the resources that we're establishing and will continue to build. We have established a hotline at the Emergency Operations Center. This is someone who, live. We have, I think, 3 or 4 individuals now who are just constantly fielding calls from the community. At the EOC, the number is 415-473-7191. It's staffed business hours, Monday through Friday. And then it is a warm line in evenings and on weekends. We also have a web page dedicated to our coronavirus response, which is posted here. Anyone in the community who wants to get regular updates by email, we have an email subscription service. It's COVID-19@marincounty.org. If you send an email to that address, you will be added to the distribution list for regular community updates. And we're also offering regular social media posts and news releases, and also making ourselves available to abundant requests from the media for comment and clarification as we move forward, recognizing that the mainstream media is also an important avenue for access to our residents.